To this discussion now, suicide remains a major public health crisis in South Africa. This is driven by socioeconomic struggles, mental health challenges and violence. Despite ongoing efforts to find solutions, stigma and systematic barriers hinder progress. Earlier this week, COGTA Minister Velenkosini Hlabisa raised alarms over the rising rate in suicide, now urging those in distress, especially due to unemployment, to seek help. Joining us now is psychologist Dr. Sam Chweneemang to discuss the root causes of suicide and practical ways to support those at risk. So, Doc, thank you so much for your time this hour on the program. So what are the leading psychological and social factors contributing to high suicide rates in the country?
Good morning, Mxolisi, and good morning to the viewers as well. Indeed, Mxolisi, there's really a variety of factors that usually would lead people to committing suicide. As you alluded, indeed, there are personal as well as socioeconomic factors that really do play a role in having people to see suicide as an option or a way out of their miseries. So you'll find that quite often people who really engage in an act of suicide have been, in the majority of cases, been quite depressed for quite a while without many of us noticing, because mental illness is intangible. Mental illness cannot be seen through the naked eye. You need to be able to read certain behavioral signs that are going to indicate that someone is under a lot of distress. So as you said, quite often we find that people have been either diagnosed with depression or could have been diagnosed with depression, if at all they never got an opportunity to go and seek help. And also anxiety that is brought about by all these kinds of threats, socioeconomic conditions, as you have indicated, where people really face a lot of uncertainty about their lives. And quite often you find that people become so much distressed that options and alternatives in front of them are not actually, they cannot identify those, and they ended up finding themselves in a tight corner and having nowhere to go and seeing suicide as the only option that they've got.
And here's the thing, at a time where we're having this conversation, so much has also been put on the public domain, especially when we look at suicide. You know, I saw research has also shown us that men are at risk to be the ones that are the most to commit suicide, Doc. Let's talk about this, because at a time where we're also dealing with, misconceptions of so-called indodaikali, a man doesn't cry. Just how quick should a response be from the immediate support structure, particularly when we look at people that are potentially in distress?
That's very true. Research has proven over the years that men are quite a very risky crew when it comes to demographics. But it's precisely because there are elements that play a role, which definitely expose men to be a risk group. Socialization, the way men were brought up, somehow that contributes to that. Men don't have the urge and the desire to go out and seek help. Sociocultural dynamics, indodaikali, as you said it, as a man and you want to show your soft side and you really want to go out and seek help, it's as if you are a weakling. And as a result, men end up indeed opting only for going for self-destructive behaviors. As for women, of course, we know women are better said to be expressive. They don't bottle up issues. They go out, they talk amongst themselves, they talk to family members, they talk to friends. And this definitely helps them to be able to experience relief and even cope better as far as dealing with their challenges is concerned. So, indeed, there are things that one needs to look into when it comes to when someone might be at risk of really either being depressed and most likely to self-harm and eventually being suicidal. when you look at the behavior of the person, you see sudden changes. And when you know that this person has experienced certain stressors within their environment, it could be recent losses. We've been talking about loss of employment to many South Africans, to many men for that matter. And men have got a responsibility to take care of families and loved ones. So one can imagine the pressure that men incidentally happen to face when they lose jobs and they lose any means of survival in terms of living. So one needs to look at behavioral changes that are there. When someone starts to be irritable, they seem to be quite angry, they withdraw from interaction from others, and sometimes you even see people starting to line up things, to straighten out things. They look for policies, they look for this and that, they organize themselves in ways that are quite strange, but quite often policy. This is not always obvious. These are not things that without someone being forthcoming, it becomes difficult to pick them up, because they are not always at one space, and hence they can be easily missed out.
And I want us now to turn focus, Doc, to South Africa's severe mental health treatment gap. Just how can the country realistically improve access to mental health services for its citizens?
This is actually an issue that's quite troubling. Over and above the fact that mental illness or mental health is always being second-guessed when it comes to priorities. Quite often, illnesses that are taken into account are those ones that are tangible. When you see that someone is suffering from a physical condition of some sort that can be diagnosed easily. With mental health and mental illness, because of its invisible nature, I think society and authorities and everyone else has a tendency to overlook it. But also, in terms of capacity within our health care institutions, they need to be capacitated really with proper human resource. You need psychiatrists, you need psychologists, you need all these that are in human services to be able to deal with these challenges. But at the moment, as we can see, even with medical doctors, medical doctors, there's such a serious shortage. Worse, with psychologists, you find that one psychologist is servicing, instead of maybe 1,000 patients or within that group or within a community, it's more than that. So you end up having professionals who are themselves fatigued, who are themselves burnt out. So it is really important that the state, the government, really augments and heightens the services to particularly really push back the effect of mental health issues, because this is what we are grappling with currently. Even most of the physical conditions actually come as a result of mental health challenges. If one is stressed, if one has got anxiety, they are most likely to develop somatic or bodily issues, your aches and all that, which may just complicate and compromise even the physical health of the individual. So it's very important really for the state. And this goes for a lot of other social services. There is a need really to really work on this and to make sure that citizens and residents have access to the services so that we do not experience the kind of scourge that we are facing with, or that we are facing in terms of suicide rates and so on, and people even resorting to substance abuse, because it becomes another escape route for people to cope with the mental and emotional distress that they are facing.
Yeah, and you just led me straight to my next question. It's no secret that in the country we're dealing with a healthcare system that is overwhelmed. And with South Africa's high suicide rates, Doc, and an overburdened mental health system, should suicide prevention be mandated as part of primary healthcare?
Actually, mental health intervention should be mandated, but it can only be mandated if resources are in place. And also, if there is healing and psychoeducation, social education that is being undertaken to destigmatize mental illness, because that's one other thing that actually makes people to go out and seek help. And therefore, even when there might be resources, but for as long as there is stigmatization of mental illness and mental health issues, then it's gonna be difficult. But indeed, maybe that's the route that we could go for, to mandate that people should actually have that. And the state, the state should be mandated. It should form policies that mandate it definitely to render services that are mental health orientated.
And before I let you go, just what policy changes, maybe funding mechanisms and training programs would make suicide awareness viable, particularly in under-resourced areas? I'm talking about your corpos as well as other areas as well.
There are non-governmental organizations and institutions that I know that are doing the best they can to really engage in social drives to psychoeducate the population, to psychoeducate people and human beings about mental health issues. But this is not enough. Indeed, there is a lot of funding that is needed. And I think there will have to be innovations. There will have to be initiatives that are going to really make sure that there is a contribution. It could even be from business, because some of the things that we are faced with, somehow business might be complicit. Business might not be really raising their hand as far as reinvesting whatever that they get from society. But if they do, perhaps that is not being channeled through proper mechanisms so that the intended result can be attained in terms of empowering people to know about mental health, mental illness, and most importantly, the fact that suicide is not a solution. It brings a lot of psychological distress to those who remain behind. It doesn't solve problems, it compounds problems, because now, once a life has been lost, then there are other things that need to be put in place. There are other things that are taken out of the picture, which could have added value to the lives of those that might have taken their lives a living way.
It's never too late to seek help. Thanks very much indeed for that. That is, of course, Dr. Sam Chweneemang there speaking to us there about the root causes of suicide and practical ways to support those at risk. And of course, the SADC suicide helpline there is 0800 567 567. That's 0800 567 567. It's also on your screen at this moment.